Hello everyone, Travis Freeman here with this month's Ask the CFP segment. This month's question is, how will healthcare law changes affect me? Now, without knowing your personal information, let's go through some general scenarios on how changes to America's healthcare laws may affect most Americans. First, as you may know, as of the date of this video, the House of Representatives has passed proposed legislation that would make changes to the Affordable Care Act, also known as Obamacare. Some of those changes include eliminating the penalty for not carrying health insurance and allowing pre-existing conditions to be excluded from a health plan if you have not carried health insurance for more than 63 days in the prior 12 months. Pay close attention to that 63-day rule. It essentially means that per this proposed legislation, as long as you don't have a lapse in health insurance coverage, your pre-existing conditions cannot be excluded. The Senate is working on their own version of a revised healthcare law, so it's possible some of this will change even further. However, in general, the Republicans want to give the American people more options and give health insurance companies more flexibility. This will likely decrease health insurance premiums in 3 to 5 years. That's news I'm sure anyone would welcome. However, the downside is that fewer Americans would carry health insurance either because they can't afford it or they just don't feel it's needed and the penalty's gone. Now let's assume the Democrats take control of the House and Senate sometime in the future and want to make their own changes to the healthcare laws. If those changes are in line with the spirit of the ACA, that law will likely focus on insuring more Americans. This could be done by not allowing higher premiums on seniors, which would increase costs on younger, healthier people. It could also be done through new taxes on businesses or certain taxpayers. As you can see, there are pros and cons to both the Republican and Democrat philosophies on healthcare. So what does this really mean to you? Well, it all depends on whether you're young, old, wealthy, poor, or anything in between. If you're middle-aged, middle class, you may not experience much of a change at all regardless of who's in control. However, no matter what may change in the next few years, I would prepare for healthcare costs to continue increasing for at least 3 more years after the passage of a new law. I would also say it's wise to carry some type of health insurance coverage at all times. Don't let that coverage lapse if you can help it. That 63-day rule is a very important one. If you have a question you'd like to submit for next month's video, please send it to tfreeman@rfgadvisory.com. Thanks for watching, and I'll see you next month.